Hello everyone, my name is Zhou Jingyi, a doctor. Today we are going to explore a topic that has been gaining significant attention in both the medical community and public media: the relationship between GLP-1 medications and eye health. We are living in an era of rapid medical innovation, and it is more important than ever to understand the nuances of the treatments we use to manage our health. Knowledge is the first step toward safety. Recently in Japan, we have been hearing more and more about drugs such as GLP-1 receptor agonists, such as semaglutide, as skinny drugs. It is attracting the attention of a modern magic wand that will have a dramatic effect not only on treating diabetes, but also on improving obesity. However, we must always look beyond the primary benefits to understand the full spectrum of a drug's physiological effects, especially on systems as delicate as our vision. The development of GLP-1 agonists wasn't an overnight success. It is the result of over 30 years of intensive clinical research. Originally developed to help manage type 2 diabetes by mimicking natural hormones, these medications have proven themselves to be versatile tools in the fight against metabolic disease. This long history of research is what allows us to identify even very rare signals, like the ones we are discussing today. The effectiveness of these treatments has been life-changing for many, providing a powerful tool for weight loss and blood sugar control. But there is no zero-risk magic in the medical world. Every highly effective medication requires a deep understanding of its potential side effects. Recently, reports of a potential serious eye condition in users have sparked intense debate among global experts. It's time to check the exact temperature sensation together. The subject of debate this time is a disease with the very difficult name: non-arteritic anterior ischemic optic neurosis, or NAION. Simply put, it's like a stroke of the nerves in the eye. This refers to a condition in which the optic nerve at the back of the eyeball becomes bloodless, causing sudden loss of vision or a loss of part of the visual field. This is not a common condition, but it is a serious one that demands our full attention. When blood flow to the optic nerve is interrupted, the nerve tissue can become damaged quickly due to a lack of oxygen. Once damaged, it is difficult to completely restore the nerve, which is why this is considered such a serious potential side effect. Recent research data reported that diabetic and obese patients taking semaglutide were statistically several times more likely to develop NAION than those on other medications. We must understand why this signal is appearing. The study that sparked this discussion observed a group of patients over a multi-year period. While the numbers were higher than the control group, we have to look at the why. Is the medication directly causing the ischemia, or are the patients who need this medication already at a much higher risk for vascular issues in the eye? This distinction is the key to understanding the actual risk versus the headlines. All I hear is, "That's a horrible drug." You may feel that. Oh, don't look so scared, because I'll explain it carefully. The important thing here is the original frequency of occurrence. We must distinguish between a statistical signal and the reality of a patient's individual risk profile. While a correlation was noted, NAION remains an exceptionally rare condition in the general population. According to recent meta-analyses, which are studies that combine data from many different trials, experts agree that the absolute risk of NAION remains very low overall. These aggregated studies provide a more reliable picture than any single report. In the medical world, consensus is built over time, and currently the consensus is that for the vast majority of patients, the benefits of treatment are significantly higher than this rare risk. It is also important to remember that diabetes and obesity themselves are major factors that damage blood vessels and increase the risk of eye conditions. High blood sugar levels and systemic inflammation put significant stress on the delicate vascular system of the eye. Often these medications are prescribed to patients who already have high-risk vascular profiles, which complicates our ability to isolate a single cause for a sudden ischemic event. At this stage, it's what we call a yellow light, a signal that we should monitor patients more carefully during treatment. In medicine, almost every highly effective drug is associated with rare but serious potential side effects. The key is the balance of benefits and risks. GLP-1 agonists offer truly immense benefits for heart health and weight management, which often far outweigh the rare risks when used under expert guidance. I have seen many patients in hospitals in China and internationally, and the guiding principle is always balance. These medications provide critical cardiovascular protection and sustainable weight management success. However, we must use them with knowledge and care. We need to use it knowing and using it right, rather than ignore the risk or abandon the treatment out of fear. Knowledge is our best tool for safety. Beyond medication, there are steps you can take to support your ocular health. A diet rich in antioxidants, leafy greens, and omega-3 fatty acids can support the health of your blood vessels. Managing your blood pressure and staying properly hydrated are also critical components. When you support your body's overall vascular system, you are directly supporting the delicate vessels in your eyes. This holistic approach is essential for any long-term treatment plan. So, how do we navigate this safely? First, do not purchase or use these drugs on your own through personal imports. Unauthorized sources are outrageous and dangerous. You must work with an endocrinologist or a specialist who can monitor your metabolic and vascular health throughout your entire treatment journey. Professional oversight is your first and most important line of defense for both your metabolic health and your vision. Second, ensure you schedule regular eye exams. An ophthalmologist can monitor the health of your optic nerve and establish a clear baseline before you even start treatment. This allows your healthcare team to catch any subtle changes in your vision or nerve health early on. I recommend a comprehensive eye exam at least once a year while on these medications to provide that vital layer of protection for your vision and peace of mind. Third, if you notice any discomfort or sudden changes in your visual field, such as unexpected blurriness, new blind spots, or a general dimming of your sight, consult your doctor immediately. Early detection and intervention are our best defenses against permanent nerve damage. By being proactive and listening to your body, we can minimize the rare risks and keep the focus on your overall health and long-term well-being. Ultimately, your health is protected not just by the medicine itself, but by the open communication between you and your healthcare team. Don't be overly afraid, and don't be overconfident. Use the tools of modern medicine with knowledge, and always trust the specialists who are there to support your journey. Your vision and metabolic health are both incredibly precious assets that we must protect together. I hope this deep dive has brought you some peace of mind. I am happy to bring this knowledge to the people of Japan and to all of you watching. We are all in this health journey together, learning and adapting as the science evolves. I'll see you in the next video where we'll continue to decode complex medical topics. Thank you for your serious attention today. Take care of yourselves and your vision. Goodbye for now and stay healthy.